What is the best way to manage disease and promote health? Well, in my mind, there's no doubt it has to be a holistic approach. Now, as I said that, some of you guys are totally on board and would totally agree, whereas others, as soon as I threw that word holistic out there, it probably brought up some discomfort, some unease, maybe some little warning bells started going off. But let's talk about that today and what a holistic approach looks like. What's up guys, CW here again from Consider It Health, where I consider some of the big topics in health today. And today's topic is an approach to health, which is known as holistic medicine. Now, a lot of people are turning to alternative approaches and complementary approaches because the traditional medical model has not worked for them or has failed them. Now, what makes holistic medicine so confusing is that there are so many things thrown under this umbrella. Some practices which are definitely credible and helpful, and others which are questionable, and some may be downright harmful and dangerous. And so holistic medicine is something that could be helpful, but we have to define exactly what it is. So let's turn to Google and see what they say. So according to the first search result that shows up on Google, it says holistic is characterized by the treatment of the whole person, taking into account mental and social factors rather than just the symptoms of a disease. I like that. That's pretty good. Or there's also one from thefreedictionary.com and says it emphasizes the importance of the whole and the interdependence of its parts, which is great too because holistic has the word whole in there, and so it's basically addressing the whole person and not just separating out all the individual constituents of the person. It sees everything in a comprehensive way. So for me, having been trained in the allopathic medicine model, but as well as receiving additional training in holistic and functional medicine, I've seen the pros and as well as the limitations of both approaches. And so I want to talk about that today. So number one, what holistic medicine is that it is not anti-medication. Now, granted, medications have caused a lot of harm and has failed a lot of people, and it can have a lot of side effects, which if you haven't seen my previous video, you can look at it there. But the point is, a truly holistic medicine model will look at medication as just merely a tool in the tool belt to be used occasionally and used very judiciously. So number two, what holistic medicine model is it doesn't just substitute a supplement for a medication. So someone says, oh look, you have high cholesterol, don't take that statin, actually take this red yeast rice instead. Or you have a sleep issue, oh just take melatonin, just take valerian root and you'll be fine. Or you have depression and oh don't take those drugs but take the 5-HTP. So granted, again, supplements have benefits and supplements may in a lot of ways be safer than certain medications. But again, if you are just simply treating a symptom with a herb or a supplement without digging deeper for the underlying cause, in a way, it is just like a traditional medical model where you're just band-aiding symptoms, except it's just under a different banner. Number three, holistic medicine should not be anti-science. Science is valuable, studies are valuable, best practices are valuable, so to completely, utterly disregard that, to me that is not a truly holistic model of looking at health. And number four, what it is not so honed in on just one issue typically. And what I mean by that is that oftentimes practitioners and patients alike can often get so honed in on, oh, everything you're experiencing is due to just your thyroid, or everything you're doing is just related, must be your diet. If you fix that, you'll be 100% fine. Or there are these doctors that are specialists in hormones. Oh yeah, everybody has hormone issues, let's treat that, and that's the root of everyone's issues. That is not a truly holistic medicine model of looking at things, right? It is looking at one thing, maybe two things, but truly to be holistic, which again by definition means considering the interconnectedness of the whole body, you oftentimes have to address multiple factors and not just physical. Oftentimes it could be emotional, social, spiritual, all these different components, because you tug at one part of the net, other parts also move. So that is something to consider when we're thinking about a truly holistic medicine model. So having spent all that time on talking about what holistic medicine is not, let's talk about what it is. Number one, holistic medicine does value evidence-based backing and evidence-based studies, but it is also open to other alternative therapies that do not yet have the scientific literature necessarily to back it up. And so we know this is so because there are a lot of beneficial things out there that just don't receive enough funding to get the studies to prove whether they work or not. And we can just use, like, for example, acupuncture as an example. Acupuncture for years and years and years was thought to be kind of a ridiculous therapy. I mean, sticking needles into someone to open blocked chi or blocked chakra, that just sounded completely absurd, right? But nowadays there's been more evidence that shows that it seemed to work for certain conditions. And so much so now that so many insurance companies will actually even cover a number of sessions for people. And so I think there is going to be more and more data showing a lot of these therapies that people are pursuing will be helpful later on. They find that there will be evidence for benefit. Now, I think obviously one has to show discernment in this area, and it's very tricky to navigate sometimes to weigh the pros and the potential benefits and the potential harms. And so if the potential for benefit, it seems like it's something that could be potentially really helpful, and the downside is very low, oftentimes it's just more financial than anything else, then that might be something worth pursuing. Secondly, a holistic medicine model will look at the basic lifestyle habits. Look, it's not sexy, it's not glamorous, it's not all that exciting, but really so much of what we deal with in terms of chronic illness comes down to the basics. Smoking, excessive alcohol use, a sedentary lifestyle, poor diet, toxin exposure, excessive stress, all these different basic things that if they were just addressed, a lot of the healthcare problems would just dissipate. Now, it's so much easier oftentimes to want the magic pill or want a quick fix or even want a supplement to try to fix all these things, right? But essentially, a truly holistic way of approaching health is addressing all these different parts. And again, remember, that's what the definition is, seeing everything as an interconnected whole. And so all these things must be addressed. Finally, a holistic medicine model looks for different layers of causes. So what do I mean by that? I think it's best if I explain by example. So let's just take, for example, I feel some heartburn after I eat. Okay, so then we do some exploration. Oh, well, it's actually GERD or gastroesophageal reflux disease. And so that's one layer. Okay, we named it, but then some people might say, okay, well, what causes that? Well, it's because you are not eating well or you're obese, and so that's causing the problem. And that's usually as far as most traditional medicine approaches get. Now, how do we dig even deeper than that? So just as an example, okay, why is this person obese? Could it be because they have hypothyroidism? Okay, now that we named it, why do they have hypothyroidism? Oh, they may have hypothyroidism because they're loaded excessively with a certain toxin, or they're exposed to too many endocrine disrupting chemicals, or they're deficient in certain minerals that are important for thyroid function. Why are they deficient in those things? Maybe they have a malabsorption syndrome. And so you can see how you can dig 4, 5, 6, even more layers deep. And so that is a truly holistic medicine model, to look at diseases and dig at causes and root causes and even causes of those root causes. So you can see how that would also require some work from a trained healthcare practitioner that is well equipped in that area. And so it may not be easy at times to find practitioners like that, but that's something that a truly holistic medicine model would strive for. So anyways, I hope those things were helpful today, and until next time, take care. So what one thing did you learn from today's video? Leave me a comment below, and I'd love to hear from you.